All right, everyone, welcome to Dueling Scalpels. I'm your host, Abhishek Parmar, and here with me, as always, is my best friend, Dr. Corey Campbell. You're not gonna say anything? All right. I talked to AI, and we're supposed to have some kind of cold open to make us interesting, but I guess it'll be that you'll sit there in complete abject silence for the whole podcast.
I'm letting you introduce me. That's all I was doing.
You can introduce yourself. Let's go.
All right. I'm Douglas Corey Campbell. I'm also a general surgeon. I've been friends with Avish for over 20 years now. And happy to be here. Happy to start this podcast with you guys.
Yeah, and I'm Abhishek Parmar. I am also a surgeon. I'm an associate professor of surgery here in Birmingham, Alabama, at an academic hospital. Corey is a surgeon in community practice. And Corey, you want to tell our friends out here how we met and why are we friends?
Yeah, so we met in the first year of medical school, and I believe we were both mentors for potential prospective medical students. And Abish caught me out and about doing my socializing thing. He said, "Hey, that guy looks like he's having fun. I want to be a part of that." And I was like, "Come right ahead, man." So ever since then, we've been friends, and we noticed that we have similar arc slash whimsical, cynical humor. So that's where we've been.
Yeah, that's not the story. You just made that up. The story is that we're both misanthropic jerks, and we were at this mentoring thing, and we both left because we thought it was lame. And that's when we realized we were best friends forever.
That too, but uh, I think it really happened when you found that I was out one time and that you didn't get invited to come out with us, and I was like, I don't know you like that.
Well, Corey, we're making history. I have some stats for you. Did you know? Actually, let me ask you this: how many podcasts do you think are out there? So this is our very first one. In a minute, we can get to what are we doing here and why should anybody care about anything we have to say. But what do you think? How many podcasts exist live in 2025?
I don't know, 500,000.
There are 2.9 million podcasts out there.
Holy mackerel!
Yeah, according to Spruce, my AI friend, tells me there's 2.9 million.
So are we number
And
3 million?
that'd be great. We get an award for hitting 3 million. We
Yeah,
should look into
exactly.
that. I'll make some calls.
Can we be considered early adopters then if we're the 3 millionth podcast?
I'm not sure how that works, but so listen to this. So how many of those do you think have three or fewer episodes? This is going to be us.
80%.
Yeah, about half. So let's try to make at least three of these bad boys before we find out everybody hates us and let's quit. Um,
Okay.
so that's the two of us, and I think that's a decent that's a little sampling of for the audience for what we're about. But I guess do you want to try to explain why did we decide to do this and what's our goal for this? Are we egomaniacs for wanting? I think anyone who does a podcast is egomaniac, right?
A
Like
little bit. A little bit.
who really you want to hear like us talk about things? But what do you think? What's your take on this concept and what we're doing here?
Yeah, I agree with you. I think it's it's like senility. You expect people to really care what you think, your viewpoint of the world, but in honesty though, I think our viewpoints are very unique from our occupation standpoint. I think our viewpoints very unique from our age standpoint, and I actually do believe that there is not a small number of people who would be interested in what we thought about the world, at least from our vantage point. So I think there's a lot of things that me and you see eye to eye, and there's a lot of things we see differently. And I think that interplay also will be interesting to people. So that's where my take is. I also think we're funny. That's debatable. That's subjective. But so I think we can make a pretty good time of it,
Yeah,
entertain
my
as
wife
well
my
as
wife would
educate.
disagree. My wife
Yeah,
would disagree.
she hates to see us interact. She thinks it's the worst thing ever.
So let's do a podcast
So
for
let's
the
let's
general
let's let's
populace.
yeah, let's spread that malice to the world.
Someone that loves both of us and is forced to be around us actually doesn't want to be around us. Let's do it for the populace.
Yeah, she really likes us individually, like it's separate like quantity. But mixing the two, it's not the peanut butter and jelly we think it is from her standpoint.
Indeed. Yeah, I think I don't know. I think I like our conversations, and I guess I'm an egomaniac, but most surgeons are. Let's be real. I think there's very little out there that's authentic medicine. If you listen to podcasts, but there are great medical podcasts out there that provide medical insight and judgment, so that our residents can become good surgeons, and all that's well and good. But I like the idea of people understanding that surgeons, and specifically surgeons, because I think there are medical stuff out there, but surgeons are normal. Well, on the spectrum of normality, but normal people who have feelings and thoughts and opinions, and healthcare, what it is, needs some more authentic insight. And right now, I don't think people get a good perception of that.
Yeah, I totally agree. I think healthcare is something interesting in that we all interact with it, and even us inside of it don't really understand what's going on. And at least getting our perspective on it, I think will give some people some light on what the average professional knows about healthcare and what's intentionally opaque and which implicitly opaque about the whole process.
Yeah. What do you think? So, I mean, I mentioned the medical versus surgeons. Do you think there's something unique about us? Again, we like to think we're special, right? As surgeons, that's like our ego getting in the way of things.
I think there is a difference. I think there's a difference between all the subspecialties. I think people gravitate towards what how they view problem solving. I think surgeons are more like hands-on problem solvers, and medicine is more management of problems, which is a whole different way of thinking about a problem. So I think that plays a role into it. I think also there's typically a little bit of a sociopathic part to being a surgeon in that you have no qualms about like doing what's necessary. So I think there's different mindsets about it, especially from a surgeon's perspective versus medicine or other things.
Yeah, I had a psychologist once tell me that you're a narcissist. I was like, oh, that's no, but it wasn't a great feeling. But I mean, she actually meant it as it's a practical change that that surgeons have to go through. And I don't think she meant it in that like we're self-centered or anything like that, or that we have a feeling of entitlement. But there's a certain amount of narcissism that has to go into being a good surgeon. Like you have to relax a little bit of your empathy. Otherwise, if you think about operating on a human being, I mean, it's kind of a horrific thing, right? You're opening someone's body up and moving things around, and that's crazy. If you're truly empathetic, that should be horrifying to do, right?
Yeah, and the other thing about it is like it's expected from you too, a little bit from society, because let's say there's a surgeon out there who takes his time and only has, 5 or 6 patients he sees a week. That sounds great, but nobody wants to have an operation with a guy who only does this once a day. If some other guy's doing 10 of these things a day, that's the guy you want. And that's kind of take a number situation. And but that's what you want, right? You want a guy who's like so at ease with doing this. He does it 4, 5, 6 times a day, 4 days a week, and you're just a number because you just want to be a number who is successful and runs. It goes on with the rest of his life as opposed to, oh, it was such a story. Let me tell you about it. Like nobody wants a surgery to be a story that they get told that has a narrative. Like you just want it to be a procedure and be over with.
That's an interesting take on it. I never really thought about that. It's good to kind of have a number, but I mean, you're right. Like, no patient should be really great friends with their surgeon, right? Oh, I've known my surgeon for 10 years. He's operated on me 6 times.
Yeah, that's not good. That's not good. I tell my patients that all the time. I say, I want to be some guy that you forget about and have to like really think about it hard to recall that guy because that's how non-issue that was our interaction. It was just it happened and oh yeah, I think it was what was that guy's name? It was 5 years ago. I can't remember. That's where you want to be. That's a great surgeon right there. That guy's like forgotten about and that problem's forgotten about 5 years later. If you're like if there's some story and there's cookies involved and multiple family meetings, it went really poorly.
Yeah, but it's interesting. Most people don't jump to, and I think we're both empathetic and kind people. Like, I mean, That's the other really interesting thing about this perspective. I mean, we clearly care about our patients. I mean, I think every surgeon does. It's a human being you're taking care of, and you're in charge of them. But yeah, you need them to forget about you, right? And let that side of things go quickly.
Well, yeah, and I think the other thing is too, you got to divorce what you're doing with who you're doing it for, right? Like meaning like it should be case number 5608 or whatever, but there's a person attached to case 5608. Like there's that dichotomy of thought, right? Like where it isn't anything really, but at the same time there's a story behind it. So it's hard. I actually think it's hard, especially for some more sympathetic people or sympathetic situations.
Yeah, no, absolutely. There's a lot to unpack about the surgeon's mindset. I think so. A lot of podcasts do that kind of stuff, right? And they have interviews
Mm-hmm.
with surgeons, probably more important and more interesting than we are. But
Mm-hmm.
I think for me, it's kind of seeing the direction medicine has gone since the pandemic that's
Yeah.
making it different. And like you said, our position is kind of people that have been doing this for 10 years. So we're almost pretty much split, right? Like I guess
Mm-hmm.
we were a little bit like what, 6, 7 years before the pandemic in practice, and now 3 or 4 years after. We have a pre-post comparison of what life is
Definitely.
like.
Yeah, we had a
And that's
professional life before it all happened, and we've had a professional life afterwards. And like you said, it's a fairly even split. I believe 5 years before the pandemic and 5 years after. So the before and after is kind of interesting. It's not concerning a little bit.
yeah. Yeah. Well, that's something we'd like I want to get into in future episodes, maybe then even in the next episode. Spoiler
Yeah.
alert. How do you think people get their understanding of medicine?
Well, I mean, if you ask me, I think it's just like my average understanding of the courtroom is for watching Breaking Bad or watching some media.
Few good men.
Yeah,
It's just
exactly.
a lot of
I
screaming.
I imagine there's yelling and emotional music playing and swelling at the conclusion. So I think it's all media interpretation. Like I honestly, that's the only way you can really be involved. That or personal hands, like first, first party interactions with it. Otherwise, I don't know how you would know anything about this stuff. I didn't
Yeah.
know anything about it when I first started. I mean, I kind of vaguely had an idea and talked to some people who, but I didn't know. I didn't know what happened behind the scenes.
So if pop culture is the way patients consume their understanding of medicine, what's the most accurate representation?
Honestly, man, I think Scrubs is pretty accurate, man. I mean, like, I
You
think.
have to explain Scrubs, my friend, because we have an audience that's not
Oh yeah, Scrubs
in
is
their
old now, and
40s.
then it's had a revival recently. It's back on TV, but Scrubs a show from the '90s, right?
Yeah.
2000s. And it basically follows the life and times of two residents as they kind of maturate, and then I think the latter season they're attendings at that point. But one of them's a medicine doctor, one of them's a surgeon, and there's a lot of interactions between them and other doctors, including attendings and residents. But there's also a lot of interaction between them and nursing staff, environmental staff, and although their interactions are kind of wacky in the show, they're realistic in that these guys aren't doing everything. There's like people all around, like there's personnel all around that they're interacting with to get the job done, and there's like pressures from higher ups and people, peers, as well as lower people that they have to deal with. So I think that's fairly accurate. I mean, like I said, the scenarios in the show are they're definitely done for dramatic standpoint, but as far as interacting with people, as far as like how much time you spend at the hospital, I think it was fairly accurate.
Yeah, and I think you left out the key thing. I mean, it's a comedy, and everyone on the show is ridiculous in one way or another, right? They're afraid or they're caricatures of, and I think that's going back to this idea of authenticity. That they're just authentic. Like they're doctors and they're smart and they work hard and they do all these things and they're in this unique position, but at their core, they're just like normal people.
Yeah,
And
they're flawed in incredibly human ways, right? Which is not the case for most doctors, like Doctor Strange, who's just like this like super narcissists that I've never met in real life, and I've met some narcissists, present company included. And so like that's like a crazy guy, or they're just like they're saints and like they never have any moral trepidations about what they're doing or how they're going about their business, which is also just completely. Or they're just like they do everything. Like ER was crazy. Like they did everything, and like nurses are just kind of writing notes, I guess, in the background. I don't know.
Yeah, best medical drama TV show of all time.
Mm. I personally liked House when it first came out as a procedural, just because the diagnoses were real. But I mean, they hunted zebras all the time, and they have four guys working on one patient. That never ever happened. Like a whole team of people thinking about one guy. That's the most incredible waste of resources of all time. Like maybe the president gets that treatment, but nobody, like random guys on the street, nah, nah.
Yeah. So House, we also need to clarify because House is also from that era. We were in med school, like in the early 2000s, when House was on, and it's this medical diagnosis show. And I don't know, his Dr. House was his name, and he's this brilliant physician, clearly a narcissist,
Yeah,
clearly devoid of empathy,
a misanthrope.
but brilliant in his ability to diagnose disease. And this show's insane because, a lot of times you can make the diagnosis with basic blood work, but they start with like a brain biopsy. How many times have
You
you
know,
heard of a human being getting a brain biopsy? They do that like out the gates on House. It's insane.
well, the other thing is too, like they had something on there that I've never heard before, and they call it a full body scan. I was like, you mean a CT? Well, why is that such a crazy thing to do? Like, why is that page 3? That happens like literally like within 20 minutes of you hitting the door of the ED. But like they're like, we should get a full body scan. I was like, what? So they
Only
ran.
after the brain biopsy though.
Yeah, exactly. Only after you've done like some incredibly invasive thing that you decide maybe we could just put them in the CT scanner and see what's going on. I don't know. That part was, but the reason I liked the show was because at the time when it came out, and this has more to do with our what age we are, the medical jargon was legit. Like you could go and get your textbook out and find this diagnosis that had like a 1 in 50,000 incidents and be like, wow, that's real. Like, but like you said, the whole point of the show was diagnostic, and the diagnostic way was so the antithetical of like actual medicine. There's no algorithm involved. It's just like gut feeling and like shooting at the hip, which is just not real. That never happens like that. Like there's some algorithm that most people are following, either medicine or surgery. And once that algorithm fails you, people are just kind of like, mad ideas. I mean, I hate to say it that way, but it really is
Yeah.
one of these things where you're not just kind of shooting at the hip with diagnosis. But like I said, I loved it. It was accurate as far as the jargon and the actual disease process, but the actual medicine process, complete fiction.
The question was, what's the most accurate? You just said it's
Oh, I thought you
complete
said my
fiction.
favorite. I thought you said my favorite.
Clear narcissistic behavior. Your favorite equates to the best.
The most accurate. Honestly, I couldn't tell you. What do you say?
Well, you kind of have to be with the times. Have you watched The Pit?
I've seen a couple episodes of Pit. It seems really good.
The Pit's really good. I think they do a really. It's a very real, and I think the visual depiction is really. They had some lady give birth to a baby that looked realistic, which is crazy. It's wild. I don't clearly understand how they did that. It's not CGI, but it's not only is the visual depictions real, but the like you said, the medical diagnostics is very accurate, right? Like they do the things. The one thing that's insane about the show is that the ER doctors are the best doctors in the hospital.
I'm not. I'm,
Now,
I'm not touching that. You're gonna make some of our colleagues very upset. These turf wars about who's the best.
well,
I don't
so
need these
listen,
problems.
I'm not gonna get into a discussion of who is the quote best, but you can't make one one subset of medical specialties the best. I don't think surgeon's the best. I'm going to go ahead and say there, but the show is so over the top that the ER physicians are better proceduralists than surgeons, which is nutso. So a patient
Mm.
needs an ED thoracotomy. For those who don't know, this is like you open up someone's chest with a knife, and the ER providers are the ones making sure that gets done to the highest quality while the surgeons watch and take notes, which is ridiculous. Let's just put it plainly. So there is that.
Yeah.
I mean, it extends to everything. Like there's one episode where some poor hospitalist comes down. Hospitalists are uh, medical doctors that work only in the hospital and take care of patients and really have great medical knowledge. And their job is to take really excellent, thorough history and physicals. And there's one episode where the medical doctor comes down all angry because the ER resident accidentally noted that they had a history of appendectomy, and it wasn't accurate. But apparently, the medical doctor didn't get their own history, which is ridiculous because they would have gotten the best history because that's what they do. So anyway, that's the one thing that's cringe is that the ER guys are like the best, and everyone else is on the sidelines, usually getting in the way or being obnoxious or not doing it correctly. So
Well, I tell you what, I did see the reason saw an episode or two is because my brother wanted me to see it because he's been watching it. He really loves the show. And there was a surgeon on there who came down definitely decaffeinated and was just such a jerk about everything. It's so condescending. He's like, "Is that real?" I was like, "Get
you
15
know
on the
what?
day and the time."
Exactly. That's what I was gonna say. It's like, you know what? Ask me on a Monday morning when I've coming off vacation versus 6 days into call where I've been sleep deprived.
Yeah,
And
yeah.
that's different. That's for episode 2, my friend. We'll save that. We'll keep that in our back pocket. But what about best? We talked about the TV, best comedy TV, comedic movie all time.
Best comedic movie from medicine accuracy.
Yeah, yeah. No, man, just pick your favorite comedy. We're not doing that. We're here. We're trying to make
Oh,
this
okay.
medically focused.
So the comedy has to have doctors in it. Is that where we're going?
Yeah, that's medically relevant or valuable.
Can they be pretending to be doctors? 'Cause
They're actors. What are you talking
no,
about?
I'm saying like the reason I say that is because Spies Like Us, that appendectomy scene in the tent, has me dying laughing every time. I don't know if you remember that movie.
I never saw that.
Movie from the '80s with Chevy Chase and Dan Aykroyd in it, and there's
Oh,
and they
yeah,
have
you
a
are old.
they're supposed to be spies, and then they infiltrated Afghanistan family like a tribe, and they pretend to be doctors, and they have to pretend to do this appendectomy on a guy. That's one of my favorites. But what about you?
Patch Adams. The right answer is Patch Adams.
Patch Adams
Next
isn't
question.
really. It's a comedy drama though. Like
No,
okay,
I'm correct. I won. You're supposed to be like, oh yeah, you're right. That's the right answer.
it's a good movie. I ain't gonna lie to you.
Medical drama, best medical drama movies.
Couldn't tell you. You go first. Tell me what you got.
Oh man, there's so many. Well,
You tell me.
I'm the one who came up with the question, so I had time to think about this. Oh, so Gattaca, see Gattaca,
Is that a medical
Ethan Hawke,
drama?
It's pure medical drama. Genetic, actually, my wife's a neurogeneticist, so genetic alterations and the ethics around it.
Okay.
Brilliant movie, brilliant. Gattaca's up there. Awakenings, De Niro. All right, so Awakenings is like the 1980s maybe movie about uh, dementia and how it takes over your mind, and very sad, really super depressing. It's one of those movies you watch once and you just kind of put away, never again.
Yeah, I remember watching that and not wanting to see that again. It's like a Brian
Yeah, it's like
song.
Schindler's List.
It's one of
I
those
don't even
movies
see
that's so
that.
heavy.
I've gotten
And
to a
for
point. Speaking of our age, I've gotten to a point like in my life, like my just life, real life is sad enough. I don't need to go to the. I don't need to spend 2 to 3 hours
oh yeah.
absorbing sadness in
Mm-mm.
an intensified form. I'm over it. I'm gonna watch a Minions movie over that nonsense.
Yeah, I could totally understand that. Gattaca, so you
Malice,
say
Malice is
Gattaca
up there.
Awakening?
Malice. Malice
Malice.
is Malice. Speaking of a fantastic caricature of a surgeon. If you haven't seen Malice, friends, it's a great movie. Alec Baldwin plays a cardiac surgeon that's just so over the top. It's fantastic. But
What about
all
something the
right,
Lord made?
that sounds like a lot. I haven't seen that.
That's the story about a black guy who was a surgical assistant to a prominent surgeon in Johns Hopkins. It's actually a really good historical drama. I got a question for you though. Do you find yourself not able to enjoy medical dramas and medical comedies as much as you would have if you weren't a doctor? Is it like one of those things where the inaccuracies pulls you out immediately?
See, I think it's actually the opposite. I think people who are in medicine get more drawn to that because you're an active participant and you get to kind of shout at the TV. You know,
Hmm.
you can like throw the proverbial tomato at the screen and be like, that's what my wife and I are both doctors. And so and she's a pediatric neurogeneticist. So anytime there's a neurologic thing or a pediatric thing, she gets to shout about the little small inaccuracy. And, I get to yell about the surgical stuff. So I think it's actually more engaging that's why I think it's fun to play this game about what we think is most representative of real life as a physician. But the pit also is temporally relevant, right? Like
Yeah.
everything that's going on in the world today, like it'll talk about all the controversies, which we're not gonna get through. We're just trying to make it to episode 3 right now.
Yeah, maybe we'll have an episode where we kind of go through the accuracies of certain shows, or at least certain uh, popular shows that people know about. Because
Yeah.
people ask me all the time, and half the shows I can't even tell them I haven't seen,
Yeah.
like The
Well, it's
Good
like you said,
Doctor.
if the public perception of what we do is only through pop culture, I mean, how else would it be, right? No one wants to sign it. You're not going to sign up for a sham surgery to experience what surgeons are like. But that is the one thing that bugs me about the pit, though. It's the surgeons are still jerks, right? I mean, I think that's another trope that I mean, I think everyone gets to be a little bit ridiculous from going through the training you go through, but I don't think that whole trope that we're soulless or you have to be a certain way or a certain type or something to be a surgeon. Like again, we're just people, man.
Yeah, no, I don't think. I think there's a little bit of over indulging of that the poor actor side of it all. I think there's, and we'll talk about it in a future broadcast. I think surgeons interact with so many people in a given day that like it is very easy to lose your courtesy, your composure with one or two people if you're interacting with 60 in a day. It's just the nature of things. I think
Yeah.
it'd be like, similar to waiters or somebody like that who interacts with a lot of people, and then the show will show that the waiter's just like curt and mean to people. You're like, well, I don't know how many people you had to interact with before you lost this cool.
Yeah. No, I mean it's human nature, like you can't it's just tiresome, right? So,
Yeah, exactly.
um well, all right, we hit the 30-minute mark, so I think we need to wrap this bad boy up. So, I think this is it for episode 1. So, join us next time when I ask Corey if he would do this all over again, and we'll get into the dark depths of his mind and really find out just how broken Corey is. Thanks, everybody.
Bye.